my name is Mackenzie, and today I'm going to be accessing a port on a patient. For demonstration purposes, I'll be using this mannequin. Today is January 23rd, and it's 10 o'clock in the morning, and I'm going to go ahead and get started. So when you access a port, typically there's several different kinds, but today I'm going to be doing a Metaport, and that's just right here in the chest. So my patient is in the hospital setting, and this is how we're going to administer medications, draw blood, that sort of thing. So what I'm going to do is I'm going to make sure that my patient understands what we're going to be doing. Typically, if they have a port, they're probably pretty used to this kind of thing. So I'll explain why we're accessing it and what the procedure is. I've introduced myself to the patient. I've washed my hands good and clean with soapy hot water, and I've provided my patient privacy. So now I'm going to go ahead and go into my patient's room, and we're going to start the procedure. So first what I'm going to do is I'm going to put on my hand sanitizer, and I'm going to put on my clean gloves, and this is so I can palpate the port and kind of get an idea of where I'm going to be inserting my needle. Okay, so before my patient already has a mask on, and the reason that my patient has a mask on is because this is directly, it's like a high area that can lead to blood infections, so we want to make sure that neither I or my patient helps increase the risk for that, so that's why they have a mask. So now I'm just going to palpate here on the chest, and it looks like my port is right here. So now I'm going to go ahead and take my gloves off. I'm going to wash my hands again, and I'm going to access my sterile field. So washing my hands. Okay, I'm going to open my sterile dressing kit. And I open that away from me. And the first thing on top is my mask. I'm going to go ahead and pull that out and put that on. And so since the rest of this is sterile, the next thing I'm going to drop in is my needle. And then I will open this away from me and drop that into my kit. And normally it would not fall out, but since this is demonstration, we're just going to say this is sterile because I don't have any more needles. Okay, so I'm going to pull out my sterile gloves. I'm going to put these on. I'm going to fix this hand. Okay, now that I have my sterile gloves on, I can get into my kit, and actually before I cleanse, I'm going to go ahead and hook my normal saline syringe up to my needle just to kind of get it ready to go. Okay, so now that that's set up, I'm going to get my ChloraPrep and go ahead and clean. So we're going to clean vertically and horizontally about a 2 to 4 inch area around the port. So vigorous cleaning. This mannequin's kind of hard to clean just because of the plastic. Okay. So that's all clean. You're going to let that air dry, no fanning. Just let it air dry on its own and dispose of this. And now after that's dry, we're going to grab our needle. I'm going to hold the skin, and we're going to insert the needle. Okay, and now we're going to aspirate, and we want to make sure that we have blood return in our syringe before we flush. Since it's a mannequin, we can't actually flush, but you would flush all 10 cc's, and then you would lock this off. You would remove this syringe, and you would attach your heparin syringe. And you would flush with 5 cc's of the heparin. Make sure that you unclamp before you flush. Again, the mannequin, we can't actually flush it. So we're gonna lock off, remove this. And now we're going to get our dressing, which is our Tegaderm. I'm gonna open this up. Make sure our needle is secure, and we're going to apply that over the top, and then you'll remove this just like that, and then move this little sticker and write the date and time and your initials of when it was placed. And I'm going to put my cap on my, it's not my cap. Put my cap back on my catheter, and that is that portion of that. And now I'm going to take off my sterile gloves, and I'm going to de-access the port. So again, you're going to need a 10 ml syringe of your normal saline and your 5 ml syringe of the heparin. You'll wash your hands, put on clean gloves, you're going to clean with an alcohol pad. So you're going to take your cap off your catheter. Clean with an alcohol wipe before you access. I'm going to aspirate, again checking for that blood return. So we have our flashback. Now we're going to flush with our 10 ml syringe. We're going to flush with our 5 ml syringe of heparin. Okay. I'm going to put our cap back on and clamp it. Now we're going to take off the dressing and remove the needle. So you're going to start from the outside, working our way in to make sure to hold the needle in place. So it doesn't get ripped out when you're pulling the dressing off. Okay, and now that the dressing is removed, you can pull the needle straight out, and no dressing is needed, and that's the end of this procedure. Thank you.